Note: all of the information is current as of March 26, 2020. This is a fast-moving situation, so things may have changed by the time you watch this video. So let's say there was a global pandemic. And let's say you had a little corner of the world you thought was safe, but then it wasn't. As of March 26th, the World Health Organization has reported cases of COVID-19 in over 190 countries and territories, resulting in more than 600,000 confirmed cases worldwide. Hundreds of millions of people are being asked or forced to stay in their homes, limit public gatherings, and only go out for essentials. But what if you're already far away from others? What if you're very far away from others? And what happens when COVID-19 still comes to you? These are the Faroe Islands, about 200 miles north of Scotland. With a population of a little over 51,000, the Faroes are an autonomous country in the Kingdom of Denmark. This means they have their own football team, their own state religion, and their own response to COVID-19. Also, side note, they have one of my favorite coat of arms and flags in the world. Look at that little goat. Such a cute goat. The Faroe Islands have had 155 positive cases of COVID-19. For a population the size of San Marcos, Texas, this seems like a high amount. The US state of Hawaii, in comparison, has had 151 positive cases with a population of 1.42 million. The difference is testing. The Faroe Islands have tested about 6.4% of their entire population for COVID-19. They've been testing everyone with even small symptoms. That's over 3,000 people on a set of islands 200 miles north of Scotland. For comparison, the 7,000 tests Hawaii has processed represent just 0.4% of the entire state population. How did the Faroese do this? One word: salmon. The Faroese export market is 90% fish and fish products. In 2000, an outbreak of infectious salmon anemia, or ISA, hit the Faroe Islands. The viral outbreak killed over 90% of farmed fish, crippling the Faroe economy for years. Since then, the Faroese have screened fish for new outbreaks to the tune of 10,000 to 15,000 per year. All of the tests have been processed on the island. Late in January, Debs Hammershab Christensen began to research if the same viral testing supplies and procedures could be altered to test for SARS-CoV-2 virus in humans. By the end of February, the lab was up and running with the capacity to process 600 tests a day, with results within 6 to 8 hours. If the samples had been flown to Denmark, it would have taken days or up to a week before the results were ready. This has allowed the Faroese government to quickly test and quarantine anyone with symptoms, and then do contact tracing to test even more. The abundance of testing in the Faroe Islands has suggested that there are two different types of coronavirus, a hypothesis that was backed by Chinese research in the beginning of March. By testing and contact tracing such a relatively large portion of their population, they've been able to keep the 3 hospitals on the island from being overrun. The National Hospital, for example, has only 10 ICU beds at maximum, so keeping the number of critical cases down has been incredibly important. The Faroe Islands are an interesting experiment in pandemic research. They were removed from the mainland, so they've had to come up with their own methods for testing and quarantine. This ingenuity has led to a situation that, while bad, is nowhere near as catastrophic as it could have been. All thanks to some sick salmon.